Thanks, Sue. My name's Tamsin Bicknell. As you said, I'm a consultant midwife in North East London. And I'm just going to talk a little bit about the cost of living crisis. I've called this a bit of a toolbox for midwives. I'm keeping it quite simple, but what it is a way of making sure that you've got things in a kind of virtual toolbox in your mind to help colleagues, help yourself, and help the families that you work with at this difficult time. I divided it into two parts. And I think just to start off by saying that I think we're all becoming increasingly aware of the public health role that midwives play and the huge amount of access into the details of people's lives that we're given, and the opportunity that we have to help them make the most of any support that's available, help them understand what's out there, how they can access it, and also look after our colleagues as well, because we know that this is not a crisis that's isolated to people who are very, very low income. It's actually reaching up and affecting most people. So this first slide is around for yourself and for your colleagues, because I'm a firm believer that actually in terms of helping professionals, we need to make sure that we're okay before we have the capacity to really do our best for our colleagues, for our patients and our families that we work with. The first thing I've put on here is organise. Are you in a union? I think at the moment we're going through the discussions around the pay award or the pay cut in real terms, as it can be seen. And I think that the beauty of being in a union is that you are part of something bigger and you are part of something that can enact positive change. As well as responding to the ballots, getting involved, being an activist in whatever way you can, there is power in those numbers. Like, we are the union, and actually if we don't step up and speak for each other and speak for ourselves, then those things won't change. Unions also have things like hardship funds. Lots of us might be in the RCM. They've teamed up with the Cavell Trust for nurses. They have a benevolent fund, so you can apply for anything really that you need. It might be something really small, like your cooker stopped working, or it might be something a bit bigger, but there's access to that and information on the RCM website, or whichever union you're in. I'm sure they all have them. In terms of employers and your local councils, I think this is something that is varying quite a lot across the country. There's been some really good examples of trusts who've planned things like school uniform swaps, hot meals for children of families that work for them, hardship grants. I think we would all recognise that it's a pretty sad position for trusts to have to be in, to be organising food banks for their employees. But that's kind of where we are at the moment. So I would say, again, if you're part of the union, you might be part of your staff side group. These are the people who can have contact with those who are high up in the trust and actually ask those questions. This is something that I've been doing locally at my trust. Our staff side union, we are asking the trust what their plans are to support. They've been directing us to some of the things that are being organised by our local integrated care board. And they're talking about how lots of the staff that work at the hospital, so residents in the area, so they'll be able to access support that way. I think this is an area in which we can challenge our employers, because we as staff are the greatest assets of any organisation. And if people don't have enough to eat, they aren't able to heat their homes, they aren't able to spend money on getting to work, there would be no services. So they have a duty of care to us as well as their patients. I think we also find that lots of trusts will have employee benefit schemes. So there might be something in there that would be useful for you, things like childcare vouchers, transport support or bike schemes, discounts at certain shops, and those can be really useful when you're planning for something like a Christmas presents. I think the next one around getting money literate, I think this is something I've not always been particularly money literate, and I think there's lots of people who might be eligible for certain benefits but not realise. It's not just for people who aren't working, and this may particularly apply to those on the lower bandings. So your maternity support workers or your healthcare assistants, your domestic teams, people who are working part-time. So it's worth using some of the resources that I'm going to talk about a bit later to see whether any of those are applicable to you. Something like working tax credits, child tax credits, tax allowances for if you're married. There's all sorts of things, and they don't necessarily automatically get applied to your tax. It's always worth checking, whether you're on the right tax band as well. If you've had a change of role or you've changed your hours, or there's lots of reasons that things can be adjusted and be slightly wrong. So it's always worth looking at that. Most of us would have heard of Martin Lewis's Money Saving Expert website, really useful, and you can sign up to email updates with things like good offers, advice, and links to other organisations that might be able to support. I would say also it's really, really worthwhile seeking some financial advice before pausing or quitting a pension scheme. There can be implications from that. That it's not necessarily very easy to understand. So actually seeking some support around that and some advice before doing that is a really good idea. You may still go ahead and want to do that in the end once you've thought about it and heard, so that you're making an informed choice, but it's definitely worth checking. I think the next one is around being mindful of the impact that money stress can have. And similarly, I think there's been so much in the press throughout the last few weeks, the summer, talking about this impending crisis and how awful it's going to be. And, I know I've been feeling anxious because of that. And I think there's tools out there to try and understand what impact it's going to have on you in your particular situation. But also just that anticipation of what might be going to happen or what is happening, that causes a lot of stress and anxiety. We're in a situation now where we've all been living in a lot of uncertainty for the last 2.5, almost 3 years now with the pandemic. We've had a summer where we've got a changing Prime Minister. There's so much uncertainty, so much doubt about what the future is going to look like. And a lot of us have used up a lot of our stores of resilience. We're seeing lots more people accessing for the first time mental health support. I think there's probably a lot more people out there who could do with accessing some of that. And that's why I've put this in here. If you think about the capacity you have to give care to your clients, most of us as midwives, anyone involved in the maternity world, you've come into this because you want to be able to give help and support and be there for people. And I think lots of us come into this profession as people who want to help fix problems. And I think there's real power in knowing where the limits are of what we can solve. We can't always solve everything. We can only do what we can with the information that we have and the information that the people that we're working with give us. Knowing that and knowing the impact that if you're up to here with what you can cope with, and there's lots and lots going on at home, that's going to be taking up a lot of brain space that you normally would have in order to give to your clients and your families and your mums and babies. So actually, if you've been reticent about accessing support in the past, or it's just not something that you're used to doing, or you don't know anyone who's done that before, I think sometimes seeing it as something that is beneficial, not just for you, but for your family, for your friends, for your children, and for your clients, to make sure that you've got the capacity to give what you want to give to them, is a way of kind of getting around that kind of fear factor around accessing support. One of the upsides of the last few years that we've been through is that there's a lot more focus and a lot more availability on support for staff through our NHS organisations, or the NHS as a whole, or even in society as a whole. So most places will be able to help you access improving access to psychological therapies, IAPT, CBT, things like that really quickly. Other employee assistance schemes. Anything from, one-to-one support, group sessions, online if you feel a little bit like you'd like to talk to somebody anonymously. And there's actually a really good NHS leadership. I'm gonna send some links so that you can access these things I'm talking about, but a self-assessment for an online self-assessment for anxiety, depression and post-traumatic stress disorder, which tells you whether you need to go and seek extra help and how you do that, or whether it seems like things are okay and at a manageable level for you. And the good thing about all of those things is they're free, so they're not going to add an extra impact that if you were seeking private therapy that would have. And then the last one is that I'm going to be talking to people today who actually are going to be less affected by the cost of living crisis, who might be insulated because of their income or whatever else is going on for them. And if that's you, then what is it that you can give back to your community, your colleagues, the families that you work with and for? So it could be anything from increasing your charitable donations, reviewing your charitable donations and looking for local charities or charities like the Trussell Trust, food banks, or whatever that looks like for you. It could be actually giving to a food bank locally, or it could be volunteering your time if money isn't something that you can give but you still want to give something back. So there are lots of opportunities to be able to give something back if you're in a position where you aren't worrying about this in the same way other people might be. And now this slide is about thinking about for clients and their families. And I think the first one I put in here because actually I think this is a difficult conversation to have with people. We're used to having lots of quite intimate conversations and asking intimate questions of people. This isn't necessarily one of those unless you are working in a particular role where this comes up. So working with vulnerable clients, say, or homeless clients or refugees, asylum seekers. And I think if you are unused to asking questions like this, then actually planning how you might ask that question might be a really good way. Sorry, I've accidentally gone forwards. Of kind of getting used to asking that question and not feeling strange about doing it. So this is true for all sorts of difficult conversations, whether that's approaching, the fact that you need to make a social care referral, or with a colleague, you've got somebody that you'd like to discuss something that you've overheard them saying, or, whatever that is. Planning how you might broach that conversation can be really, really helpful if you aren't used to doing that, or if you're feeling anxious or nervous. So I've put an example here. Lots of families are struggling with the cost of living crisis. How are you managing? And actually, I think that what that does is put it into context. So actually, you're not alone. If you're suffering and struggling, then actually that's a very common experience. It's not something to feel embarrassed about. It's not singling them out to say that you think they will be because of whatever judgment you might have made. So it's kind of opening up that question. They might say they're fine, it's okay. Or they might say, actually, no, it's not fine. I'm really struggling. I'm really worried about the future, or I haven't been able to pay my fuel bill, or whatever it is that they're struggling with. And then obviously the next part of any opening up conversation about any difficult topic is worrying about how you might respond. And I was talking about how lots of us in the midwifery world, the maternity world, all the helping professions, we can be kind of fixers. We want to fix the problem. But I think something that's really, really important to remember is actually that listening in itself is therapeutic. And giving somebody a space to talk is therapeutic in and of itself. Acknowledgement. So an example of what you might say back to that question would be, that sounds really stressful, that sounds really hard. And then have you considered X? I could make a referral to a local service that does X for you if you like. So what you're doing is you're saying, I hear what you're saying and I'm listening to you and I'm acknowledging what you're going through before you start going into fixer mode, which is also super valuable thing to be doing. But there's a quote by a really amazing psychologist called Karen Treisman, says, every interaction is an intervention, and you don't have to be a therapist to be therapeutic. And I think this is a really good example of that. Just giving somebody a space to check in with them, to let them know that you care about how they're doing, and you care about their circumstances, and that you're hearing them and giving them a space to talk about how they're feeling about it is, I think, a really, really important thing. The next one is around knowing your local context. So this is about getting to know your local area, your region, and even things that are available nationally. And on the next slide, I've put some examples of my kind of local toolkit, and then you can go away and adapt that and add in any local organisations, regional organisations where you work and where you live. But there are so many, and this is it's an amazing thing to recognise how many people have set up organisations and charities that actually put in amazing practical financial resource support for families. Some of these are really small grassroots ones, and this will be your local, and some of it's more national, and it might be advice and signposting, things like that as well. So knowing what's available in your local area and what would work for which circumstances is a really, really important thing, because being able to make referrals to people that are going to give people the support that they need in a meaningful way is a really big gift that you can give to your families. It is worth thinking about as well that another way of accessing support if all other avenues have been exhausted is around children's services, so social services. And this would be looking at a child in need or a Section 17 assessment. And this is looking at, it can be practical financial support for a child in need, and a child who's going to be living in extreme poverty, who's not going to be able to have a warm home, food on the table, to have a home at all, so children at risk of homelessness, and that includes people who are sofa surfing, staying with friends or family. Then that can be a way of getting them that support that they need. And another significant group it's very difficult to get support for are those who have an RPF condition, so that's no recourse to public funds, means that they can't have any benefits, they're not eligible for benefits because of immigration status. And that's a real challenge as a midwife when you're working with somebody. And sometimes we might find that support isn't available until a baby is physically born, and that can be really, really challenging too. But actually that Section 17 of the Children's Act is there to step in when there are no other options. And it's, I think, really important to reassure families that this is about supporting them. It is absolutely not about removing their children. It's not because you're worried that their children aren't safe in their care. It's about the support that they need to stay together and to live out of poverty or abject poverty. The last one I put is about assessing the capacity of the client. And I don't mean doing a mental capacity assessment, even though that is always something that's worth having in the back of your mind. But this is more about, what's going on for that person, and do they have the capacity to go out and follow up information that I've given them? Do they have the capacity in terms of, do they have internet at home? I've put here considering somebody who has older children, so they've already got children they're caring for, who's socially isolated, with extremely limited money, might not be able to get to the job centre or get to somewhere to access support. She might be struggling with getting children to and from school. She might not have anyone to look after the children if she wants to go to an appointment for something. Or a young mother struggling with mental health problems might not have that kind of emotional capacity to do what she needs to do. Especially, somebody suffering from depression, we know that can really limit their ability to go out and be proactive about, getting their needs met. Or somebody with complex substance use, their addiction is going to be causing them to prioritise using and finding the whatever it is that they're taking, and they're not going to have the capacity to be able to meet their other needs necessarily. So those people will need more support from you to access the support that is available. So, you know, somebody who's really well supported, having the first baby, all those others that kind of just as normal, as kind of uncomplicated as can be. If they're a bit anxious about something, you can give them IAPT contact details, and you can probably be confident that they're going to be able to access that on their own. But for somebody else, like what some of the people that we've talked about just now, it might be making a referral for them on their behalf rather than getting them to do a self-referral. It might be helping chase that up and speaking to the people that you've referred to. It might be advocating for them if they've missed an appointment not to discharge from a service. It might be, you know, trying to find them a family support worker or a key worker who can help them get to appointments, who can encourage them by going to meet them at home and bringing them. So it's about making that judgment about what, you know, how much input is needed from you and how much have they got to give in order to support them in the best way possible. And then this last slide is just an example of my directory. These would be things that I would use on a regular basis. So at the national level, you've got things like the Citizens Advice Bureau, you've got Gingerbread, which is a charity that supports single parents. Crisis, I'm sure lots of us are referred to, is around support with housing. It's not necessarily going to get people housed, but if they have issues around the quality of their housing, or they've been made intentionally homeless and they want to appeal that, then Crisis could support them. The Trestle Trust I've mentioned is a food bank charity, but there are lots of local organisations as well. I've put Twitter on here because actually I find Twitter professionally a really, really useful space. So there are lots of organisation and people on there that will share resources, share links, and I think, you know, for me, it's a really, really useful space for finding out about things that I wouldn't know about otherwise. The Maternity Action are a really amazing charity that give free legal advice on various aspects of kind of maternal rights. So that might be anything from access to NHS care for women who aren't eligible for free care, or access to information and support around people who have been maybe made redundant or having work issues in pregnancy, to benefits and welfare and things that you might be able to access. Again, Turn to Us, I think, was originally kind of created for families in Edinburgh, but actually it has loads and loads of resources in terms of, you know, there are lots of charitable grants that you can apply for support in the short term, or, you know, on a slightly larger scale as individuals, and support for your families to access that too. It's a bit of a repository for that because it can be quite hard to really drill down and be aware of everything that's available in your local area. They also have helplines and kind of advice. And the Fuel Bank Foundation, you can probably tell from the name, will give small grants to people in need with support for their fuel needs. On a regional level, for me, I'm based in London, so this would be a London-wide kind of thing. And there is an amazing charity called Birth Companions that I work with quite a lot, who will help people. They'll, you know, have one-to-one support for women in that kind of in need of more social support and help to access services. Little Village is one of, you know, lots of charities that redistribute used baby children items, so anything from clothes to toys to prams and car seats. There's a really amazing number of organisations that will take nearly new items, pre-loved items, and distribute them to people who need them. And this actually is another thing that, you know, where I work, we have a maternity unit Instagram account, and we'll often have people getting in touch with us through that account saying, I've got some, you know, premature baby clothes that I'd like to donate. You know, can you take them? We can't take them. I mean, we have done in the past, but we've run out of room. So what we do now is we direct people to things like Little Village, and in the local section here, I've got the E5 Baby Bank, which is one local to me, but there's lots of these, and it's really worthwhile sharing this with your families in terms of people who need it, and also for those people who have things that they can give as well. And that's another way that we can kind of help people do what they can do as well. Back to that regional level, there is a really amazing resource from Project 17, which is going back to that Section 17 of the Children's Act, and it has a booklet that gives advice on how to access support, how to deal with issues that families have commonly had when accessing support, because sometimes it can be a bit tricky to navigate those systems, and other organisations that people might need in terms of appealing decisions, like how to find a community lawyer that you can access for free, things like that. I've put on here the ICS, and I previously mentioned that. Most integrated care systems, and I'm going to just explain briefly my understanding of what they are, because they're very new and it's a change. So these bring together health and care and local authorities and charitable organisations in a region that has been prescribed by the powers that be, to work together for their local population. So for me, it's North East London. And they have a responsibility and a remit to look at health inequalities, and most of them will be making plans and looking at what they can do as a system to support families during this time. I've also put the local maternity and neonatal systems, which is the maternity bit of the ICS. So in mine, my hospital works with all the other maternity units in our area, and between all of us professionals from those areas, we'll be able to signpost and put together information, bringing together information for families about everything that is available in our area that can support them. And all LMNSs will be in the midst of making their equity and equality plans, which should be taking into account social deprivation and what, the way people are living in their area, and what maternity services and others and partners can do to help families locally. Then just a little bit more about that local bit. The local authority, so your local council, is a really, really important player on this. It's worth signing up for updates, email updates for your own council, and also for the council if you work in a different council, because lots of them will have individual schemes, and again be sharing lots of collated information about what's available in the local area, very small organisations you might not be aware of, extra support that they're putting in place. So it's worth getting those on the go as well. And just checking with colleagues. Midwives who care for vulnerable women are particularly knowledgeable about this stuff already, because they are regularly referring families and assessing what signposting needs to be done. So make use of the resources that are available to you, and build yourself a directory, so that when these conversations come up, which they are going to increasingly over the next few months, you've got something to do and something to go to, so you feel like you can make a difference and you can fulfill that need to help fix that we all have. Thank you very much.